Hello. Around the world, there are more than 380,000 cases of COVID-19 and approximately 17,000 deaths. We're watching closely our neighbors to the south in the United States with more than 44,000 cases and approximately 600 deaths. In Canada, today we have close to 2,900 deaths and 2,900 cases and 29 deaths. We've also seen a concerning trend of increased community transmission in other parts of the country. And although in PI we still only have 3 positive COVID-19 cases, I want to be clear that we expect this number to rise and we will have hospitalizations from COVID-19. I say that just to be clear about the seriousness of the situation that we are expecting here in PEI. I also say it because we need to continue to understand the importance of self-isolation and social distancing. As of this morning, there have been close to 500 tests completed here in Prince Edward Island. We have the 3 positive cases, but we still have almost 250 tests pending for results. Patients who've been tested are frustrated at waiting for the results. I'm frustrated, and it is a difficult thing to wait for results to come back. I know that the National Microbiology Lab is doing the best they can in a situation where they're having to test thousands of people and process those results in the country. We're continuing to test here. We want people to be tested who have symptoms and who have traveled, and we'll continue to do so. And as I've mentioned before, we are working as quickly as we can to increase our own testing capacity here in Prince Edward Island. Today I want to mention the fact that we have deployed a National Emergency Strategic Stockpile, or a NES mini clinic, here in Prince Edward Island. This is a federal asset which is made available to PEI and is one of only 4 locations in Canada, and it's for use in a provincial emergency. And this was an asset that we actually had made available last fall, and it is being deployed because of this situation. It will function similar to an outpatient clinic, which will allow for increased capacity in terms of testing, for instance, and it is meant to be a location to divert people away from acute care who may not need to go to hospital. And further details on the location will be made by Health PI in the next few days. And although I feel like I talk about it every day, I need to talk about social distancing once again. If you are not in a period of self-isolation for those 14 days having returned from travel, everyone should stay home as much as possible. And if you do go out, keep that 2-meter distance away from other people. You can walk with your family, but don't have people over for a dinner party. For those in self-isolation, that means anyone who has traveled outside of PEI, whether internationally or within Canada, for a period of 14 days upon your return. Now, we have been working with enforcement officers over the last day or two to help us with those who are in self-isolation and to make sure they understand what that means. Our enforcement officers have made it clear that for them to follow up with those who are in self-isolation, they should be staying on their property. And I think that is a little different than some of the messaging that we have said before, but it will allow concerns and complaints to be investigated more easily. So it is not forever. It is for a period of time while you're in self-isolation. It will be okay to go outside and get fresh air, but you must stay on your own property when you do. That has been something that certainly with the enforcement officers, they've wanted us to be more clear about. And for those in apartment buildings, you can still go outside, but it will be on the property of the building, and it's important to practice social distancing while outside. We need to rely on each other and reach out to each other for those who are in self-isolation, because it is a very challenging time. And if you are someone who has completed that period of self-isolation for that 14 days has passed, and you know that period of time has passed, you must now continue to practice social distancing. I know I've been asked by email and phone to clarify a number of situations, and I may not be able to address all of them, but hopefully I will over time. I do want people to know we are working on guidance and advice for families who co-parent. We are working on advice and guidance for those who may be homeless. We have been receiving calls regarding people traveling off island with family members for medical appointments. And I strongly recommend that you do not go anywhere except where the medical appointment is located. Of course, you may need to stop for gas, for instance, but you must practice social distancing. And for medical appointments, you are not required to self-isolate upon your return, but continue to practice social distancing. I want to remind Islanders that if you've traveled out of province or internationally and are experiencing symptoms related to COVID-19, call 811. And of course, if you require immediate medical assistance, call 911. And I think it's important to mention, though, if you have medical issues, serious medical issues, you should still go to the ER. Significant medical issues should not be delayed. And there are processes in place to avoid possible infection with COVID-19. I know being in self-isolation and practicing social distancing is challenging, and I've said that before and I'll continue to say it. But everyone still needs access to essential items and services. Government has established a new toll-free number to help Islanders in need, and we're finding that people have so many questions, and they may be related to different areas, not just health. And so it's almost a bit of a phone that can redirect your call to the most appropriate area. It's a one number that will act as a hub to connect Islanders to the various services they may require, but all the other 1-800 numbers will still remain in operation. I want to mention the caremongering groups that are online to assist Islanders in receiving what they need. And I'd like to thank so many kind Islanders for reaching out and helping where they can. I'd like to be clear that all travelers, whether they're from New Brunswick, Nova Scotia, Quebec, when they're in PEI, need to be very careful in practicing social distancing when they need to get out of their cars for gas or food or other stops that they may need to make. I'd like to remind Islanders that working from home, when possible, is the best option. We've been asked specifically to comment on the fact that lawyers and accountants, for instance, can continue their work at home, connecting virtually or by phone with their contacts wherever possible. And today we are looking at our list of essential services and non-essential businesses and looking at what is included in other essential and non-essential businesses across the country, and we'll be updating that list to make it very consistent with what is going on across the country, but also be very clear because we are getting specific questions about what is essential and non-essential. So we hope to have that available before the end of the day. I would like to thank Islanders, and I want to thank them every day for their cooperation and continuing to look out for one another. These measures around social distancing and self-isolation are being done to put physical distance between us in order to stop the transmission of the virus. And these tremendous measures will have long-term impacts on our population. And they're long-term impacts that we will have a hard time measuring and anticipating now. Yet what we are trying to do is control this pandemic. This is not over, and I cannot say when it will be. But what we are doing today is influencing tomorrow. It will influence not just tomorrow, but it will influence the next day and the next week. We need to keep going together, but apart. Thank you.
Good afternoon. I want to begin by thanking everyone for their cooperation and understanding as we continue to offer essential services and adapt our care areas in preparation for COVID-19 patients. We're working together as a health system in our response. And across the province, we're doing planning to expand our testing clinics as we move forward. We are currently able to meet the demand for screening and testing, but we're planning for what the future need may be. I want to reiterate what Dr. Morrison said about people needing emergency care, and our emergency care centers are open, and people should please call 911 or come to our emergency departments if you have a need for that service. For Islanders needing other health services, we now have options in place for appointments by telephone for individuals who are self-isolating or practicing social distancing. This may be the preferred option for some patients, such as seniors or those with compromised immune systems who are most importantly needing to protect themselves. Planning is underway for additional options for internet-based or video appointments as well. We continue to receive an excellent response to our call for professionals and volunteers, and we've had a lot of professional staff reach out to us from the private sector, as well as those retired or recently retired, and volunteers from our community. So we're working through those numbers and have a number of individuals who are already maybe working casually in our health system or who have offered their support and are now being integrated as options for us to employ if we need them. The Joint Response Team has been carefully monitoring our personal protective equipment and supplies needed for our healthcare workers to ensure they can provide care safely. Maintaining the health and safety of our staff, physicians, and patients continues as a priority. We currently have enough personal protective equipment accessible for staff, but we are conserving our supplies and being responsible in its use, given the national and global demand. We have purchased additional reusable gowns, which are now being used at the Prince County Hospital, and this has reduced our need for the disposable supplies. It's an example of how every member of our staff is supporting our response. We couldn't use reusable gowns without our laundry and housekeeping staff stepping up their efforts and work to support our patient care areas. We're working in collaboration with provincial and federal government to support our supply needs in the health system and constantly reassessing and assessing the future need for our protective equipment and supplies. This depends on a number of factors, which we're working with Dr. Morrison's office on trying to predict what our need may be. And we don't have all those answers yet, which is why we're being responsible in our deployment of those supplies now. As everyone knows, there's a need for this equipment everywhere, and the same suppliers we look to for equipment are often working with many other health agencies. Like everyone else, we're placed on allocation from some of our suppliers, so we get a fair share of our supplies. And this makes our collaboration with governments and other health authorities, as well as our suppliers, important to our success. We have a dedicated team on this file every single day, and we know protective equipment will continue to be a concern for our staff. We will do everything in our ability to have the supplies we need as we face this pandemic. We do have contingency plans in place, and we are accessing new sources for supplies and looking to extend the use and life of our existing supplies, and the move to reusable gowns is an example of this. I know Dr. Morrison mentioned this yesterday, but we have confirmed an order for 12 new ventilators for the province, which will be arriving late spring. And this is really good news as ventilators are in high demand. And an example of the relationships built with some of our vendors. This order is separate and apart from the 15 ventilators that has been put forward through the federal government opportunity for a bulk order. We do have 19 ventilators that are here and ready to go, and they'll be maintained and checked regularly.
OK, je vais peut-être faire quelques commentaires en français. Bon après-midi. Aujourd'hui, au Canada, il y a presque 2900 cas positifs et 29 décès. Même s'il y a toujours juste 3 cas positifs à l'île, je me répète, je m'attends à voir ce chiffre augmenter et que certaines personnes atteintes avec le COVID se trouveront à l'hôpital. C'est pour être clair du sérieux de COVID. Ce n'est pas pour vous faire peur. Les chiffres ne changent pas au quotidien, mais nous ne sommes pas encore au bout de nos peines. C'est pourquoi je continue à souligner l'importance de l'auto-isolement et la distance sociale. Nous devons continuer sur cette voie. Depuis ce matin, on a presque 500 tests qui ont été réalisés, mais nous attendons le résultat de la moitié. Et je sais que c'est frustrant d'attendre ces résultats. Mais c'est pourquoi je vous en parle tous les jours des 3 cas confirmés et que nous ne sommes pas sortis de l'auberge encore. Nous travaillons aussi rapidement que possible pour pouvoir réaliser les tests ici à l'île du Prince-Édouard. Nous travaillons à établir une version de la réserve nationale stratégique d'urgence à Charlottetown. C'est un bien fédéral qui nous est offert. L'île est une des 4 places au Canada pour en avoir une. Ça sera semblable à une clinique externe. Ça aidera à améliorer la capacité pour réaliser les tests. Ça aidera avec les capacités des hôpitaux aussi. Et les détails, on aura plus dans les prochains jours. Si vous n'êtes pas en isolement, vous devriez rester chez vous autant que possible. Et si vous sortez, restez avec 2 mètres l'un de l'autre. Et pour tout le monde qui a voyagé à l'extérieur de la province, que ce soit au Canada ou à l'étranger, doivent s'auto-isoler pendant 14 jours dès leur retour. Comme nous voyons de plus en plus de cas de propagation communautaire à travers le pays, et que maintenant nous avons des moyens d'émettre des amendes à ceux qui ne respectent pas la consigne d'auto-isolement, ces personnes doivent rester sur leur propre terrain. Et pour ceux qui sont en appartement, vous pouvez toujours sortir dehors, mais rester sur le terrain du bâtiment. Et c'est un peu un changement, mais on veut que, avec les moyens qu'on a, avec pour renforcer ceux qui sont en auto-isolement, c'est plus clair. C'est important de pratiquer la distance sociale même quand vous êtes dehors. Et puis, si vous étiez en isolement et que vous avez presque fini les 14 jours, vous devez maintenant pratiquer la distance sociale. Et nous avons reçu de nombreux appels concernant les rendez-vous médicaux aux provinces. Et bien sûr, vous aurez peut-être besoin de faire le plein ou acheter quelque chose pour manger, mais gardez toujours à l'esprit la distance sociale. Alors vraiment d'aller au retour strictement pour le rendez-vous médical. Et si vous respectez cela, vous n'avez pas besoin de vous isoler à votre retour. Je sais que c'est difficile de pratiquer la distance sociale et l'auto-isolement et que tout le monde a toujours besoin des nécessités et certains services. Je vais mentionner qu'on voit en ligne les groupes Facebook comme Caremongering qui offrent de l'aide aux insulaires. Je tiens à vous remercier pour l'appui que vous offrez. Je sais que les choses sont difficiles actuellement et que les choses changent rapidement. Mais c'est tellement important que vous restez à l'affût des choses et parce que ça change tellement vite. Un grand merci à tous les insulaires pour leur coopération et pour l'appui que vous vous offrez. Je ne suis pas certaine quand sera la fin de cette épidémie, mais sachant que les actions d'aujourd'hui ont un impact direct sur l'avenir. Donc, nous devons continuer à faire tout ce qu'on peut. Merci. And I'll open it up for questions in English or French for Marion and myself.
Sally Pitt, CBC.
Hi, Dr. Morrison. I think this may be a question for Marion Dowling. We understand that the province has canceled home care to some homes on the island, but not others. Just wondering how many individuals are affected and how was the choice made who gets the care and who doesn't? Hi, Dr. Morrison. I think this may
Hi. What we have done in all of our service areas, so including home care, is looked at moving to essential services. And so those decisions were made by the providers of the service based on what could safely be deferred. And we're working within a 3-week time frame of moving forward. That was since last week, to try and create capacity to provide other services and support islanders in a different way. I don't have specific numbers on the number of people impacted by that with home care, but we do have a monitor piece of portions of home care services. So I believe home support services and a number of things are still being offered for most individuals. They have only deferred things that could be safely deferred for clients.
And would that involve, you mentioned possibly some internet-based or teleconferencing, or those kinds of things being explored or options for people at home?
Yes, and they are being offered, and that's one of the pieces we've been looking at around some of our mobile units with the community paramedics as well, but the home care staff, the coordinators and others who can do things by phone and do those home health check visits and things like that over the phone with clients are able to do that, as well as physicians who are offering services from their offices can do some of those things over the phone.
Stu Neepy, The Guardian.
Hi, good afternoon to you both. Wanted to ask about testing. Ms. Morrison, you'd said that you were a little bit frustrated about the lag in getting results back. I see that the number of negatives has stayed the same for about 4 days now. Obviously, there's a lot of demand, but are there any other options, I guess? I understand Newfoundland has a testing lab of their own. Is there any other option other than the national lab in Winnipeg at the moment for getting test results back faster?
Well, I mean, I guess a couple of things. One, I think we ran into the same situation last week. Over the weekend, the tests get batched so that depending on what time they reach Winnipeg, there can be a bit of a delay for the weekend tests. But we also at one point, when the capacity was and the demand wasn't there, we were able to use some testing facilities in New Brunswick. So, but all the provinces right now are feeling that they are doing their maximum number of tests. They have the same kind of demands that we do here, and so but I am very hopeful that within the next couple of weeks we will have our own testing capacity here, and I think Stu, we've talked about it before. Once that happens, then the only tests we would be sending off to the National Microbiology Lab would be our positive tests. So if they're tested here positive, then they would be confirmed at the NML. But that would significantly reduce the number of tests we have to send off, and it would allow for a much quicker turnaround time for our negative tests, all our tests.
Right. Okay. I guess a follow-up for Ms. Dowling. Wanted to ask a little bit about Unit 9 and I guess transition beds at Mount Herbert. I'd heard that Unit 9, might be kind of reduced capacity or well, really, I'm not exactly sure what's happening at Unit 9. When it comes to sort of kind of more emergency mental health services, is Unit 9 operating? Is there any capacity for individuals who are facing sort of addiction issues for, detox? Like, is that something that the health system can accommodate right now?
Yes, we do have those services still available. But as I mentioned earlier, we have done a lot of adjusting and adapting within our pandemic plan as we move forward to create that capacity for dealing with particularly a communicable disease like COVID-19. We have to create other spaces where we can have protected areas for patients outside of those who may or may not be experiencing this illness. So one of the areas impacted by that was looking at reassigning the bed allocation within some of our facilities. And I know some of that was reported last evening as well in the news of some of the work that's been happening specifically at the Queen Elizabeth Hospital. But some of the patients who've been moved from Unit 9 to another unit are still receiving their acute mental health services, and those services are still available for individuals who need them. Similarly, the shifting of patients from other areas created capacity then for us to have an influx of patients related to the pandemic, but also created capacity for that shift in services. So other areas are now doing different things, and we've reassigned staff that have the knowledge and expertise to continue providing those services with respect to detox and addictions, as well as mental health and acute mental health. So those services are still available. They may or may not be in the exact same location they were 2 weeks ago, but that is part of our planning of making this shift to have capacity to safely care for everyone.
Sean McDougall, the Eastern Graphic.
Good afternoon, everyone. This question is for Dr. Morrison. I was having a look at the province's various web pages last night for information for businesses, and there was a page that said essential workers from out of province don't have to self-isolate for 14 days upon arriving in PEI. And I'm just wondering if you could clarify as to why they don't have to self-isolate.
I think that's where we're talking about the essential services. So, for instance, someone who may be coming over to we've used trucking as an example. So if a trucker has come over to PEI, we are asking them to stay home as much as possible, do social distancing, and really, while they're in PEI, be at home, but they may need to leave again. So they may be coming back and forth. And I think it's been very important for our whole population, not just in PEI, that we maintain our supply of goods and be able to go back and forth. So it's we're conscious that there's always a risk of people coming in and out, and as much as possible, we are very clear that people should stay at home when they're here. But we understand there would be certain, even physicians who may live in Nova Scotia or in New Brunswick, or nurses who, when they come back, we are getting them to watch very carefully for symptoms, of course, and monitor every day for symptoms. And if anything changes, certainly we want to test them, but we also need our physicians and our nurses, for instance. We have and our essential workers in a number of areas. it's certainly a challenge. We need our essential workers, but we want to protect everyone, and so it's trying to balance that and balance these measures going forward. Very good question, but that's when we put a change and update our essential versus non-essential service page there. We're going to try to use some of that language and update some of that messaging at the same time, and I spoke about it with our team this morning.
Okay, and just to follow up on that, the wording on the page seems to include temporary foreign workers, especially ones who may find seasonal employment in the agriculture or fishery industry. Are those temporary foreign workers included in that not need to self-isolate for 2 weeks?
So we are having conversations because some of the temporary foreign workers, it's certainly, it's also a federal decision regarding temporary foreign workers and how easy or not it will be for them to actually get into the country. And so it's a conversation that is happening and received correspondence about how to manage some temporary foreign workers if they come, and what that's going to look like, where they're going to be, and very important that we make sure that the messaging for any temporary foreign worker is clear. But we'll be having further discussions with the departments involved with temporary foreign workers and the companies, the businesses that would be employing temporary foreign workers. So I think it highlights another reason why we're having to look at that list of essential versus non-essential and the messaging around it.
Okay, thank you.
Thank you.
Carrie Wynn McLeod, Ocean 100.
Hi, Dr. Morrison.
Hi, Carrie.
There's been a number of citizens right across the province seems to be concerned about those that are perhaps maybe in the province that are not residents, that may just be coming for some casual travel at this time. Some people speculating that they were leaving the bigger centers in order to come here to kind of isolate themselves more away from some of the issues that are happening in their larger cities. Has there been any thought at all to simply closing the borders and the entry points around PEI to just those that may be using them for essential work, for the supply chain, or for medical appointments, and just for those that may be residents of the province?
Well, I mean, I think whether you're visiting or living in PI, whatever reason, the same rules really apply. It's you need to self-isolate when you get here for a period of 2 weeks, and you need to practice social distancing. And that message is pretty consistent in the country and in PI. I think it's not something that provinces have done across the country in terms of closing their borders. We've made a big step this week in terms of, and other provinces have also done the same thing in terms of trying to make sure people who come across the border come across our provincial border certainly have information that they need and where they need to call if they have symptoms, and then if we're also advising most people to stay home, that's what they should be doing. So at this point in time, we want our islanders certainly to be able to get home, and we need to make sure we can transport our people and our supplies across our borders, and that would apply to Nova Scotia, New Brunswick, wherever people are coming from. So I think it's something that has come up and mentioned at different times, and I think at this point in time we are not shutting borders to other people, but they need to abide by the same rules and the same messages that everybody in PEI does, and we want to make sure that that's very clear.
And also, I've heard from a number of employees, Dr. Morrison, that felt that perhaps their respective employers weren't protecting them with adequate methods as much as they should be, such as no disinfectant or hand sanitizers available to them, or social distancing happening at their workplace. What can those employees do under those circumstances if they feel they're not protected by their employer?
Well, and we've at our office, I've received emails personally about those same kind of concerns, and our office has received calls on the 1-800 line, and we are in the process of actually trying to call and back some of those businesses. Some employees want to remain anonymous, but it will be some of the follow-up that we are going to be doing on a daily basis here now. So if an employee, I guess, has a concern and they have or questions around what could be done, certainly if we can give some health information, then that would, we're happy to do that through the 1-800 line.
Thank you.
Okay, thank you.
Laurent Rigaud, La Voix acadienne.
Oui, bonjour, docteur Morrison. J'avais une question en ce qui concerne ce qui circule sur les réseaux sociaux, sur Internet, en ce moment, partout dans le monde. Des gens placent des espoirs, peut-être des faux espoirs dans certains médicaments qui seraient annoncés comme efficaces contre le Covid-19. Quel est votre avis personnel sur ce qu'on entend sur la chloroquine?
Et vous parlez vraiment les traitements du Covid-19?
Oui, il y a en ce moment, il y a des informations qui circulent, notamment en Europe, ou avec ce que Donald Trump a tweeté, et on voit des gens essayer de se soigner eux-mêmes en prenant de la chloroquine. Qu'est-ce que vous dites aux insulaires sur ces messages qui circulent, qui ne sont peut-être pas forcément corrects ou justes?
Je pense qu'on doit suivre la guidance du Canada. Et puis, il y a toutes sortes de choses qui, comme vous mentionnez, sur l'Internet, mais ils sont en train de faire beaucoup de recherches sur les médicaments comme le chloroquine, si ça marche ou si ça ne marche pas. Et donc, et d'autres médicaments aussi. Mais à ce moment, au Canada, ils parlent beaucoup d'autres personnes partout au monde pour chercher les meilleurs conseils pour les médicaments pour prendre quand vous avez COVID-19. C'est un virus, alors c'est difficile de traiter. Si on en a besoin des médicaments, ici, on va en avoir. Alors, j'écoute un peu les choses qu'on entend des autres parties du monde, mais je pense qu'une des parties pour le Canada, qu'on a une agence de santé publique, on a des experts au Canada qui cherchent la meilleure science et l'évidence, et on doit être guidé tout le temps par l'évidence, la science, et on fait ça jusqu'à date et on doit continuer d'en faire. I'll answer just because I've been asked to try to answer some of these questions in English as well. So the question was around what is being circulated sometimes on the website about different treatments for COVID-19, and I've certainly heard a range of those, but I think it's important that we follow Canadian guidance, Canadian science that is certainly looks at international evidence. And we have an advantage that we do have a very strong health system in this country, a public health agency of Canada that connects us. And medications and advice on chloroquine, particular antivirals as treatment for COVID-19. They are being incorporated into our guidance and will continue to be as required and as we learn more about COVID-19 treatments.
Je veux juste un follow-up sur ça. D'autres médecins parlent, notamment le Royaume-Uni a voulu tenter cette stratégie de laisser les gens être malades pour favoriser l'immunité collective de la population. Est-ce que vous pensez que c'est une bonne stratégie?
Non, parce que si on laisse tout le monde être malade, ça va peut-être être pas sérieux pour un jeune qui n'a pas d'autres maladies chroniques, mais s'ils infectent les personnes les plus âgées ou avec les maladies chroniques, ils vont peut-être mourir. Et je ne pense pas qu'on doit faire ça comme société. On n'a pas d'autre protection, on n'a pas un vaccin contre le COVID-19 à ce moment. Alors, je ne supporterai pas ça à ce moment. And I'll repeat the question was, should we, and as I understood it, should we just let a whole bunch of people, get COVID, spread it to each other, and then we build up an immunity to it? And certainly the danger of, from my perspective of doing so would be that for some people having COVID-19, you would recover easily from it with minor illness. But if you infect others who are sick or older or underlying medical conditions, they would get much sicker and could die. And I do not think that is approach when we don't have any other protection for our society without a vaccine at this stage. That would be something that we would support nationally or provincially right now.
Thank you.
François-Pierre Dufour, Radio-Canada.
Oui, bonjour, Dr. Morrison. Une question par rapport aux tests et la lenteur avec laquelle les résultats vous parviennent. Vous avez exprimé une certaine frustration par rapport à ça. Quelles sont vos options, à part d'envoyer présentement les résultats à Winnipeg pour les faire valider?
On espère d'avoir notre propre habilité ici à l'île du Prince-Édouard de faire les tests entre 2 semaines parce que on n'a pas beaucoup d'options. On est tellement content que le laboratoire à Winnipeg quand même processe notre test et on apprécie ça beaucoup parce qu'on sait qu'ils sont tellement occupés, mais on n'a pas beaucoup d'options à part de ça parce que les autres provinces ils ont beaucoup de tests eux-mêmes au Nouveau-Brunswick, à Nouvelle-Écosse.
Un petit follow-up, si je peux, sur un autre sujet. Vous avez mentionné cette mini-clinique-là, une seule de 4 au Canada. Pouvez-vous expliquer un peu pourquoi le gouvernement fédéral a choisi l'île du Prince-Édouard pour cette clinique-là? Qu'est-ce que ça va faire exactement? Et qui va pouvoir aller dans cette clinique-là également?
OK. Ça, c'était... on a fait les discussions pour le NES Mini-Clinic il y a beaucoup, c'était l'année passée. Et je pense que l'île du Prince-Édouard était une région choisie parce que si quelque chose comme est arrivé et puis personne ne pouvait pas passer par le pont, ça serait très difficile de chercher ou d'avoir de l'aide du pont comme tempête. Je ne sais pas quelle sorte de situation, mais c'était là pour cette raison. Et puis, ça peut nous donner plus d'espace, c'est plus de lits, c'est comme j'ai dit, c'est plutôt comme un outpatient clinic. Alors, des lits de d'équipement pour personal protective equipment. Et alors, ça nous aide à avoir plus de gens, de faire tester pour Covid-19. Et puis les détails exacts, on va discuter dans les prochains jours.
Julien Lecacheur, Radio-Canada.
Question pour vous, Dr. Morrison. Je voulais savoir concernant les îles de la Madeleine, puisque c'est mon sujet du jour, entre guillemets. Je voulais juste être sûr avec vous, les Madelinos ont-ils le droit de s'arrêter à l'île du Prince-Édouard? Ont-ils le droit de descendre de leur voiture pour aller faire de l'essence, pour manger, aller aux toilettes? Parce que selon les commentaires que j'ai eus par ces Madelinos, après avoir passé les points d'entrée, on leur a fait comprendre qu'ils n'avaient pas le droit de s'arrêter entre le traversier de Souris et le pont de la Confédération. Est-ce que vous pouvez détailler ceci, s'il vous plaît?
Alors, je veux clarifier que ceux qui voyagent des îles de la Madeleine ne sont pas obligés de rester dans leur voiture, mais les voyageurs des îles Madeleine, Nouveau-Brunswick, n'importe où, doivent pratiquer la distance sociale aussi. Et pour faire le plein, il peut, pour aller, aller aux salles de bain, ils ont le droit de le faire, mais il faut pas sortir en grand nombre et de rester en auto-isolement autant que possible, mais les personnes doivent sortir, mais on encourage les gens de pas tout le monde entre au stationnement de service pour faire le plein, mais seulement une personne qui sort. Et on veut être pratique et et je ne sais pas si ce n'était pas clair hier, mais on veut encourager de protéger eux-mêmes et les insulaires autant que possible, mais s'il faut sortir de leur voiture, ils ne sont pas obligés d'en rester parce qu'il faut peut-être sortir pour faire le plein, pour exemple.
Un follow-up sur cette question. Hier, le Premier ministre disait que on explorait la possibilité de changer l'horaire du bateau, de le passer à 1h du matin au lieu de 1h de l'après-midi. Du coup, si le bateau passait à 1h du matin, la grande majorité des stations-service ou autres magasins de restauration seront fermés. Pensez-vous que c'est une bonne solution? Parce que du coup, les Madelinos resteront dans leur voiture s'ils doivent passer à travers l'île du Prince-Édouard?
Je ne sais pas si j'ai vraiment pensé à l'horaire des bateaux. Je sais qu'il y en a 3 par semaine qui arrivent à l'île du Prince-Édouard. Et j'imagine qu'on va avoir de moins de personnes qui vont sortir des îles de la Madeleine parce que je pense qu'ils vont ils entendent le même avis de rester chez eux. Et alors, j'en ai pas discuté, mais peut-être on va y penser, mais c'est peut-être pour une autre journée. Okay, thank you, everyone.